Healthcare Final for Public Health and Well-Being by Janet L. Kitchens, Part 2. An ethical guide for public health decision making. Analyze ethical issues, risk and harm of concerns, public health goals, moral claims of the stakeholders. Are precedent cases relevant? Do professional codes of ethic provide guidance? Evaluate the ethical dimensions of the alternative course of public health action. Look at utility. Does a particular public health action produce a balance of benefits over harm? Look at the justice. Are the benefits and burdens distributed fairly? Respect for individual and community interests. Does the public health actions respect individual and civil roles and values? Provide justification for public health actions. Effectiveness. In a public health goal likely to be accomplished? Proportionality. Will the problem benefit of action outweigh the infringement moral considerations? Necessity. Is overriding and conflicting ethical claims necessary to achieve the public health goal? Least infringement. Is the action the least restrictive and least intrusive? Public justifications. Can public health agencies offer public justification that citizens and in particular those most effective could find acceptable and principles? Examples of ethical challenges identified by public health officials. Resource allegations, negotiating the political content, data use and management including privacy and confidential protection, control of infection conditions and diseases, immigration, community engagement, balancing individual choice and protecting the public good. Analyze funding of public and community health care services. Community health and safety of Americans should be the top of our nation's leaders list. Again, community health and safety of Americans should be on the list of our nation's leaders as a very high pressing matter. Some people say that the country does not give enough to the resources needed to help prevent disease and protect the American people. There are some serious gaps that exist in our nation's ability to protect us and put our families first as well as protecting the communities and states. Due to this lack of support, it has put our nation at risk. The following slide shows how the federal funding is allocated for the preventive and public health funding in 2011. This data and slide has been retrieved from the Department of Health and Human Services fact sheet and was posted on February 9, 2011. Discuss the role of communication in public health programs. Communication is a vital and integral part of the healthcare. However, it is often taken for granted and in anything that we do. Behavior change can be an effect from good communication. It can also lead to increase in political commitment and program effectiveness. Communication and information management. In order to have a reliable information management department, you have to have communication. The communication has to be very effective and work seamlessly during an emergency. Good communication stresses the development of a reliable program. The system recommends that communities build an emergency communication system that gets all the information together that is needed, especially for traffic, weather, damage, resources, etc., in order to make the decision needed and to make a public announcement. Make sure that you have your information all at hand when and before the announcement is made. Conclusion. What is public health? Public health is defined as an organized community effort aimed to the prevention of disease and promotion of health. Unlike our healthcare system that provides services to individual citizens, our public health system focuses on the population as a whole. At the local level, public health is about promoting a healthy community. What does the public health do for people? Public health can save money for an organization or even the person itself. If the public is healthy, they get sick less and spend less on their money on the health care. This will allow people to spend more money on the economy. Improving public health can also allow people and children to even strive. Healthy children become healthy adults. Public health prevention reduces human suffering. Public health prevention does more than educate people about the effects of lifestyle changes for themselves as well as their community and family. It also reduces the impact of disaster by preparing people for the things that can come, such as nature disasters such as hurricanes, tornadoes, terrorist attacks, and any other emergency situation. Again, public health is looking at the whole community. They're looking at the community as a whole, not looking at the person themselves. They're looking at controlling disease, looking at coming up with cures, special needs and effects to try to help save people from suffering. Teaching good, healthy ways will actually help a person survive and decrease the suffering of not only the person but the community itself. The following pages are references that I used and quoted within the presentation. Again, thank you.